of course, can't cover everything. But what are some of the common symptoms, and what are the stages or the expected stages with regard to dementia in general?
So the most common symptom would be difficulty with memory for recent events. And that ends up translating into people sometimes getting lost, even going on a familiar route. They may not recognize exactly where they were. They may lose things, especially, or what I mean to say is they may lose things much more than they used to in the past. So they're suddenly hunting around the house for things, or they've lost their phone and have to get a new one, or lose their wallet and have to cancel all their credit cards. And the thing that is perhaps most concerning for Alzheimer's is when people are repeating the same questions over and over, or repeating the same stories to the same people again and again and again, because they don't remember the answers to the question, or they don't remember that they've already said that story. Another very common symptom is difficulty in finding words. Now, in healthy older adults, it's very common to have difficulty remembering the name of a person or a movie or a place or something like that. But when one begins to have difficulty in coming up with common, ordinary nouns, not just names, that's a problem. And that is a reason that somebody should get evaluated, along with those other symptoms I mentioned.
And then if you could speak to the stages of dementia.
Yeah. So there are different people break down the stages in different ways, but this is the way that I think about it. So the first, let's start with, a healthy, older adult. So that would be the sort of normal stage. And then there might be an individual who's concerned about their memory and concerned about it enough that they actually go and get an evaluation for their memory. And the evaluation comes out totally normal. We call those individuals having subjective cognitive decline. And that would be the very earliest stage. And the reason that I call that a stage is half of the people who are concerned enough about their memory to get an evaluation, even if it comes out normal, half of those people will end up with a diagnosable disorder within 7 years. And what that basically says...
That's interesting.
Yeah, it is interesting. And what it basically says to me is that people know themselves pretty well. And just because there isn't enough cognitive impairment so that people score too low on a standardized pencil and paper test, there could still be something wrong. So now, I don't want to make people overly concerned, because the other 50% of people, they truly are normal and they don't have any problem. But that's what I consider the very earliest stage, is someone who's concerned about themselves. So we call that, again, subjective cognitive decline. Now, the next stage, the stage where there's clearly something wrong, we call mild cognitive impairment. And mild cognitive impairment means that someone is concerned about the thinking and memory. It can be the individual themselves, it can be their family, or it can be their doctor. When the individual undergoes pencil and paper testing, yes, a problem is found in the pencil and paper testing, but their day-to-day function is normal. If someone's day-to-day function is normal, by definition, they do not have dementia.
Could you give me an example of what you mean with regard to that?
Sure. So let's say that, I'm seeing one of my patients. Let's call him Bob. And Bob says, Dr. Budson, I've noticed that I'm really having a little bit of trouble in preparing my taxes and getting all my bills paid on time. I used to have no difficulties with these things, and now I can still do them, but boy, do they take me a lot more time and effort. I've had to become more organized. I'd had to be developing systems. I used to just be able to remember if I paid a bill or not. Now I need to make checklists to make sure that I paid each one and I don't pay any of them twice. I say, okay, Bob, well, I can understand why you're a bit concerned. It could be nothing, but let's go ahead and do some pencil and paper testing to test your thinking and memory and see how it does. We'll also do some blood work, make sure you don't have any vitamin deficiencies or thyroid disorders, and we'll do a scan of your brain. We'll get either an MRI scan or a CAT scan, and we'll make sure everything looks good up there, and I'll see you back in a couple months. We'll go over all this information. So I see Bob back, and I say, well, I see what you mean, Bob. You did have a little bit of difficulty with some of the memory testing, and that goes along with your having a little bit of difficulty, keeping track of the financial affairs that you're doing. But the good thing is your problems were really very mild, and because you've told me that you don't have any buddy that needs to help you with your day-to-day function, we would call this mild cognitive impairment. That means, yes, you have a little bit more trouble with doing some of your daily activities, but you're able to do them independently. You're able to do them by yourself. If Bob comes back to see me, let's say 2 or 3 years later, and he says, Dr. Budson, now even with these systems that I set up, I just can't manage to get my bills paid on time. And just when I think I'm doing it all correct, I find that I've paid them twice. I've even bounced a check or two because I keep paying the same bill more than once. So now my daughter comes over and helps me, and that's going really well. And now that Bob's daughter needs to help him with his bills, that means that Bob has progressed to the stage where he's in dementia. And we call it very mild dementia if Bob just needs help with the finances and not anything else. If Bob needs help with the finances plus a couple of other things, like he also has trouble taking his medications, he has a little bit of trouble with grocery shopping, if he doesn't get help from his daughter, he ends up buying the same food again and again, but forgets to get the milk. And then we call it the mild dementia stage. And then when Bob begins to have trouble with his basic activities of daily living, such as eating, dressing, using the toilet, moving from one place to another, then we call it the moderate stage of dementia. And if Bob reaches the stage where he's really spending most of the time in bed and doesn't really know what's going on at all, then we call that the severe stage of dementia. So the way that I think about the stages is it starts at subjective cognitive decline, when someone is concerned about their memory, but they're scoring okay on their tests. They may end up being normal, but they could end up developing a brain disease in 7 years. Then the next stage is mild cognitive impairment, where they're having a little bit of difficulty doing some of the complicated activities of daily living, like doing the finances or taking medicines or going shopping. And people that have these difficulties, about half of them do end up developing Alzheimer's disease or another dementia within about 2 or 3 years. And then after that, when someone has trouble where they need help from the outside, like a family member, with one of these activities, I call it very mild dementia. If they have trouble with a couple of these complicated activities, I call it mild dementia. If they have trouble with basic activities of daily living, like eating and dressing and toileting, I call it moderate dementia. And then when they really are very disabled, they're really too ill to be taken out of the house or out of a nursing home if that's where they're staying, I call it severe dementia.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.